My name is Caroline Mortensen. I'm a professor at the Miami Business School, and here's my story. I grew up in South Florida, in Boca Raton, just north of here. My family's all from Denmark, and I was actually born in New Jersey, lived in Chicago, but I associate South Florida as home, so it feels good to be home. I moved around a lot after graduate school. I moved to Michigan, and I started working at an organization called the Michigan Public Health Institute, and that's where I realized that healthcare was what I was interested in. I was always interested in large government programs and how do you finance and pay for things, but I didn't know until I started at that organization that it was healthcare specifically that I was interested in. We're definitely an outlier when you start mapping out the data on how much we spend, and you can use any metric if it's percent GDP or per capita or pure dollars, and then you can look at almost any measure of quality in terms of an outcome. And we just don't do well. Our life expectancy is not doing well. Our maternal mortality, our infant mortality compared to developing countries, we hang out down there sometimes on some of these metrics, but we spend significantly more than other countries can even dream of spending on healthcare. Right before I moved to Miami, there was a study that came out in a journal called Health Affairs, and they looked at the highest charging hospitals across the country. So they identified by name and location the 50 highest charging hospitals in the country. And it turned out that 20 of those hospitals were in Florida. So 40% of those hospitals were in Florida. And there's been a lot of movement towards price transparency, and does price transparency have an effect? And I thought, wow, this is kind of like a crude version of price transparency, is that a hospital down the street was called out for being one of the most expensive hospitals in the country. And so I was curious, so sure, if there are better outcomes, then by all means, I'm willing to pay more for higher quality, right? We do that consistently in our lives. But that didn't turn out to be the case. So what I wanted to do was look at, before that study came out, look at all the charges of we have almost 260 hospitals in the state of Florida. So I wanted to see what happened before that study came out in terms of hospital charges, and what happened after that study came out, because these hospitals are sort of working within, they have boards that say, hey, slow down, right? We're in the news because of our charges being so high. So I thought, maybe naively, that this would have an effect on charge growth over time. So we looked at the charges in the run-up to when that study was released and the charges after that study was released. We looked at the same quarter, such that there was the same types of hospitalizations. You don't want to look at January in Florida versus October in Florida. So we looked at the same quarter and saw that there was literally no effect, that the charges that these hospitals were charging patients just continued to go up. And in general, a lot of the literature coming out now on price transparency is that giving you information on how much a particular service costs isn't really having an effect on your health services shopping behavior. Florida is a wild, wild west when it comes to healthcare. We just removed our certificate of need regulation. Most states, I think 40 other states, have certificate of need, which means a hospital has to demonstrate that there's a need to build a new hospital or a need to build some additional services within a particular hospital. Florida said, no, there's not really a need for that. So we've been at the state level, there's been a big push towards deregulation of healthcare and a free market system. So you see that already in that there's not a lot of control. There's no control over how much hospitals charge. And so I think a lot of that is because oversight of hospital prices or healthcare prices has not really been in the key focus of the administration at the state level in Florida. I am a jack of all trades at Miami Business School. So I teach. My big focus is teaching. I teach courses at the undergraduate level. I direct our Master in Health Administration program, and I teach in our executive MBA program as well. Service to my profession, so for example, translating my research to Congress, is a big part of what I like to do. That's sort of like the pinnacle. You like to see that you're actually directly interacting with policymakers on what you study and what you do. And then my research, so it sort of dovetails into the professional service as well. So I'm very passionate about understanding the delivery, organization, and financing of our healthcare system.